She is a financial planner and advisor.
She's the founder and president of Zinnia Wealth Management. It's also a popular radio show.
There's a way to have the money in the market and have protected growth.
This holistic approach will help people get to and through retirement.
Absolutely.
You have to change the way that you think. It's not about having these double-digit returns anymore. Things are changing, and you have to have an advisor that's keeping up with the changes.
Your outcome is going to become very desirable if you have some sort of coach helping you along the way.
And our next recipient for the Media and Communications XP, Charisse.
Charisse Rivers.
Do not have to risk all your money in the market to survive, because it's about the retirement dream.
Good day, everybody. Charisse Rivers here, home of Retirement Coffee Talk and Zinnia Wealth Management. I will be your host. Just a reminder, every Thursday at 3:30, we'll be here. Just a reminder, my job and sole job is to inspire you, educate you, and get you to retirement and beyond. And so let me give you pregame of what's going to happen today. We're going to talk about some market updates, what's going on with the coronavirus and some vaccines. We're going to talk a little bit of Trump news and North Florida news, Central Florida news. And then we're going to go into our Zinnia U segment. We're going to educate you about Medicare. Very confusing puzzle. Talk about A, B, C, D, and what an Advantage plan is and a Medicare supplement plan and the pros and cons there. And our second part of our Zinnia U education spot is about paying off the right debt first. A lot of people have debt, and we're going to teach you the best ways and what to pay off first, which will be really great. And before that, actually, we're going to do our Zinnia U trivia. I want to let you know, you have to have all your answers in for the 4 questions I asked by end of the Facebook Live event. And then next week, we'll announce the winner. We've been getting some people emailing us and stuff. Please submit it through Facebook instead. Okay, let's get this party started. So stock market hasn't done a whole lot this week, but I feel a little bit better because we've been hitting more green than red this week and kind of been sideways. So that's definitely better than going down. Last week, tech stocks kind of came down a little bit. And now what we see is Tesla and Amazon and Microsoft going up. Amazon jumped 7.9% and 4.3% on the Microsoft. So, good moves. I'm seeing astronomical moves on these stocks, which is really interesting. NASDAQ, you have the Dow Jones, you have the S&P 500 doing a whole lot, but these tech stocks, those NASDAQ stocks, they're out off the chains. We're just going into a time period where technology is to the roof, and that's because we need technology to do Zoom meetings and Facebook Live and, DocuSigns and everything's virtual, it seems like today. So no wonder why technology and those stocks are just growing like wildfire. So maybe something to think about when you're investing in the future. Even Jim Cramer tweeted, he says, moves like we have seen in Microsoft, Tesla, and Amazon are truly insane and unlike any he has ever seen in his life. I mean, this guy's been around for a long time. So does that make him scared? Does that make you worried? Do you feel like they're just growing so fast? This is an anomaly and it doesn't normally happen. And the question is, does it stick? That's the end all question. All right. So that's enough of Jim Cramer news because that guy is crazy. All right. So let's go on to what's driving the most this week. So development and vaccines. Hey, the government gave Pfizer $2 billion to hunt down this vaccine and get it right. So now we have 2 companies funded by the government. We have the Novavax and now we have Pfizer. So now these 2 are going to be competing to see who gets it first, among others. I'm not telling you to go out and buy Pfizer, but hey, if they win the race here, is it a good buy? I don't know. I don't want to be the one to tell you yay or nay. Decent dividend. And reasonable growth, but a whole lot of, they went up, they went down, they went up. They're back where they were 5 years ago. So I haven't seen any major moves in Pfizer, but maybe this will be a major mover for them as you're thinking about what to buy in the stock market. Okay, stimulus. People are also keeping an eye on additional stimulus checks. The U.S., after European Union leaders negotiated unprecedented $2.1 trillion budget and coronavirus recovery fund to tackle the crisis. So it's great. People are working together. That brings optimism. Wall Street prefers optimism instead of uncertainty. Just remember that. Trump news, a new package. Let's talk about his new package for the stimulus is to help fund schools for reopening, basically send more checks, and work on a payroll tax cut. I'd be very interested to see what that's all about soon as well. Let's just see. I'm going to move on from Trump. He didn't have a whole lot going on today. Same old, same old. Poor governor. He is being sued. Poor guy. He's doing his best to make things work. Basically, the teachers union is suing him as of Monday. Because forcing reopening of the schools in August. So what do you guys think? Do you think we should force schools to be open, or are you on the teacher side? And so I can see both ends. I can see teachers like, why are you forcing this? You shouldn't have to, that shouldn't be a rule. Kids should go back when they want. Technically right now, schools were opening August 10th. Now they got pushed back to August 24th. And now you have two choices, do online school or go to school. So I'll be curious if that still stands, or what actually happens here with this lawsuit. Does it mean, hey, your kids don't have to go to school? And we'll see here in the news. So lots of roller coasters up and down with, markets, with politicians and decisions they have to make. Definitely not easy decisions here. So I feel for the guy right now. Now, Central Florida news. Disney basically, reopening said, hey, when you're eating and drinking, no standing. They want you to sit and eat and drink. You can take off your mask, but when you're done, you got to put the mask back on. So it sounds like full-time mask at Disney World if you are going to partake in that kind of fun. What else is going on here? Oh, here's not great news. Florida health officials reported 10,347 new cases of COVID-19 on Monday and 92 coronavirus-related deaths. So I do feel for those people, and just remember, wear your mask, do what you're supposed to do, and we're older, maybe 55 and above, be extra cautious. That's who it's hurting the most. Overall, the young people, we haven't heard any major issues there. Gainesville news. Let's see. Gainesville has some interesting things going on. There's testing this Saturday, July 25th, they're doing free testing for COVID-19. Citizens Field, that's 1000 Northeast Walder Road, and it begins at 8 a.m. this Saturday, July 25th. To get tested, go on down to Citizens Field. So that's wonderful that they're doing that. And Alachua County is opening their libraries so people can use computers and printers, but it is by appointment only. So kind of nice opening for people who do need those services. So that's Central Florida news. Not a whole lot of changes. There's a couple of updates. Okay, this is where we do trivia. Remember, trivia, if you get all 4 questions right, we send you a $100 check with your church of choice, okay? We just need to know who they are, and you can just reach out to us and let us know if you're a winner. We are now going to start announcing our winners the following Facebook Live. So make sure you put your answers in by end of this show. We'll calculate them by next week, and we'll let you know at the beginning of the show who won, and we'll be mailing out your checks. So this is going to be the first 2 questions, what we talked about last week on Facebook Live, and then a fun one, and then get to know Charisse one. All right, here we go. Last week, last CDU, we talked about insurances that you might need. And long-term disability insurance, what is the amount of your salary that I recommend to get for covered policy? Is it 60 to 70%? Is it 50%, 25%, or 90 to 100%? So one of those are the answers. Make sure you put them in. Question number 2, from our last NAU, what did I say that we want our FICO score to be at if we're getting a mortgage? Is it 700 and above, 740 and above, 800 and above? The score doesn't matter. Well, if you're listening, and a lot of people have gotten mortgages, you probably should know this number especially. So numbers that they're looking for. Okay, here's a fun question. Which of these songs were not on Michael Jackson's 1982 Thriller album? We should get this one right. Is it Billie Jean? Is it PYT, Pretty Young Things? I'm not giving any facial hints. I heard I threw people off last week. Don't stop till you get enough. Maybe, maybe not. And number D, The Girl Is Mine. Anybody else a Michael Jackson fan? Love that guy. Miss him dearly and all of his talents that came along with him. All right, last question to get to know Charisse a little bit better. What is Charisse's favorite 80s band / singer? This is so easy. I'm going to give you a hint because last Facebook Live, we had their guitar in the background. All right, number A, Def Leppard, B, C, Duran Duran, or D, Bon Jovi. Ooh, that's a toughie. There's 2 favorites in there, but there's an ultimate one. Okay, submit your answers by end of Facebook Live. We'll announce our winners at the beginning of next week. Thanks for playing. And if I went too fast, when this is all over, this is How's Live. You can go back and watch it also. Okay, let's move on. Now it's Charisse teaching you. We call the Zinnia U. Nice class and update on Medicare and how to pay off debt. So the first one I'm going to go with is Medicare, because Medicare is this jigsaw puzzle. And some of the smartest people come to me and say, Charisse, you've been doing this for 15 years. Help me, because now I'm a little bit more confused than when I start. And that's what I'm here for, which is a wonderful thing. So Medicare. We typically get Medicare when we turn 65. We age into 65, and now we don't have to take any other insurance if we don't want to because we get Medicare, which is a wonderful thing. We're going to save money on Medicare. Remember that. So I love that red, white, and blue card. So the blue card will have your name on it, and it will have the dates that A and B start, which is a nice thing. If you're not 65 and you're under 65, you can also get Medicare. That means that you're on a disability, or I think it's a permanent kidney failure to be, not just kidney failure, but permanent kidney failure. So those are also how you get onto Medicare A and B, disability as well. I just said that. Okay, so the first question is, if you're working and you haven't retired and you have a health insurance with your employer, do you keep your employer plan, or do you move over to Medicare and get something in the private world like Blue Cross Blue Shield or AARP or something like that? And here's the deal. As long as it's credentialed coverage, you can basically do either or. So with the employer plan, you're still going to get Medicare Part A, and they're going to mail you your red, white, and blue card. So if you decide to keep your employer plan because you turn 65, because you like the insurance with them, you'll have to sign the form that they send you with that Medicare card saying that you don't want Medicare Part B right now. So because when you get Part B, you got to pay a premium. So remember that. I usually do advise people, if you have an employer plan, to save the employer plan for many reasons, literally 99% of the time. So if you're turning 65 and you're having questions about this, make sure you reach out to us because you want to get this right. You'll probably save more money on your employer plan unless you're an anomaly and just one of those people that does not have a great plan. So just remember that, the employer plan. So now let's just say you retired, you're 65 years old, and I want to just go over the basics of what Medicare A is and B and C and D, because you're thinking, what is C and D? So start with A. A is your hospital paid through your FICA taxes and earned Medicare Part A. Great thing. And so when you get onto Medicare, there's no premium for it, which is great. But there's some things you need to look out for because Medicare doesn't cover everything. But let's just say you don't get any extra insurance, you just get Medicare Part A. There is a hospital deductible. The deductible is $1,408. And you could pay that 6 times in 1 year if you have a really bad year, okay? So make sure of that. So remember, no premium, you do have a deductible. And it only covers hospital, skilled nursing facilities, but very minimal skilled nursing facilities. I want you to know Medicare does not pay for long-term care. It'll pay for the first 20 days. And then I hope you have a plan thereafter. Now let's talk about Medicare Part B. You didn't earn that, so you have to pay a premium. So when you take your Medicare Part B, you're going to pay, the new premium is $144.60. Every month. It can come straight out of your Social Security check. What if you don't get a Social Security? Well, if you don't get a Social Security check because you're waiting to take Social Security a year or maybe a couple years down the road, what you would do is you would just mail in a quarterly check for that amount. Multiply 144.808 times 3, mail the check in, and do it every quarter, okay? Even if they haven't even sent the bill and you know you have Medicare, send it in because it'll catch up to you. So that's what I recommend there. So Medicare Part B, these are your doctors. This is your blood, inpatient, hospital visit, emergency room visits, that type of thing. So you pay for it. Can't get around that. And then there is a deductible. The deductible is $198 this year. So that just means at the beginning of the year, trust me, they'll cover it at the beginning of the year. If you go to your doctor's office, they're going to make you pay somewhere close to that amount to cover that bill. And then after that, they might make you pay a little more until you pay the $198 totally off. But then when that's done, you're good to go. So you have A and B totally covered. But here's the deal with B. There's a 20% copay, okay, called insurance. So Medicare covers 80% of the bill, but you are in charge of 20%. So if you're getting a major surgery or something like that, this could mean a lot of bucks coming out of your financial pocket, right? So you do want to purchase or get some sort of gap plan, okay? And we're going to talk about that next. The gap plan could be a Medicare supplement where you can purchase and you pay a premium from AARP, United Healthcare, Blue Cross Blue Shield, or Humana. There's a ton of them. United American, they're all out there. You pay a premium, and for the most part, you have no copays, no deductibles. You go anywhere you want to go, as long as the doctor accepts Medicare, right? And as long as it's medically needed, you're covered 100%. As long as you pay that premium, you now have freedom of choice to go where you need to go, but it has to be medically necessary. Okay, so do remember that. So there's a price to pay for freedom, right? So that's one thing that you can do. The second option that you can is called the Medicare Advantage plan. That leads me to Medicare Part C. Medicare Part C, all it is a Medicare Advantage plan. So in your entire lives with your employers, you've had an HMO and a PPO, right? This is all that it is. It's an HMO or a PPO or PFFS or POS. These are all different. We'll talk about that later in office. But you can get those. So what happens is when you retire, all of a sudden there's these insurance companies, I don't like teaching tricks, right? You guys are used to HMOs and PPOs. So why do we feel like when we turn 65, we have to go pay extra money and a premium for a Medicare supplement? Well, the reason is because all of a sudden you're like, you know what? I'm getting older. I want more freedom of choice. Paying that premium is worth it. Sure. And I get that. I'm agreeing to that totally. But if you don't want to pay a premium, you go with this thing called a Medicare Advantage plan, which is a wonderful thing. So most Medicare Advantage plans, the HMOs and PPOs, they don't have a premium. In Marion County, I think there's 27 of them. Only like 5 of them have a premium. I yet to have ever figured out a reason to pay a premium when there's plans in town you don't have to pay a premium for. So let's talk about the Advantage plan. So the Advantage plan covers Part A, the hospital. It covers Part B, the doctors, blood visits, any of those types of things. And it also covers your prescription drugs. So you don't have to pay a premium for prescription drugs, which is a great thing. So remember, we're going to need Medicare Part D, which we're about to talk about in a minute, called prescription drugs, RX. Advantage plans also come with hoops. Sometimes you have to jump through. So if you get an HMO, you already know that's a health maintenance organization. They kind of keep everything in one little circle. You have to follow a network of doctors. There's no way around about it. And most of the time you cannot go out of network or you're paying full price. But luckily in Marion County for HMOs, we have some really good ones. And you can go to many, many great doctors in town. So sometimes to save a premium and HMOs have lower copays and PPOs, it might be for you. But I recommend you call the doctors you're with. If you're not willing to budge and you're not willing to trade in your doctor for a plan, you need to call them and say, hey, listen, do you take this HMO? They say no. That could be your deciding factor to go, I'm going to go with Medicare Part C because I don't pay a premium if I go with one of Charisse's plans, but maybe I'll go with a PPO because that's preferred provider organization. That means you can go in network, pay a little lower copay, but you can also go out of network and you just pay a higher copay. So I know this is long-winded, but I want you to understand thoroughly and how it works. You might have to rewind this later, which is good because you're paying attention. So there's value to PPOs, okay? And you already know you got to pay for your Medicare Part B, the $144.60. Medicare Part A is free. And if you don't have to pay for a premium for the gap that you're trying to cover that Medicare doesn't pay for, that really saves a lot of money over 30 years in retirement every month. And you don't have to pay for a prescription drug plan for most of these. You're saving a lot of bucks here, people. And it's a pay as you go. You just co-pay when you go. So I do like that. Some PPOs have deductibles for the hospitals as well. So something to think about when it comes to the two. Let's make sure I didn't miss anything here. Oh yeah, those Medicare Advantage plans, some of them offer you free gym memberships to all the gyms locally, which is really great. So some people get on these Advantage plans, HMO or PPO, just to get that free gym membership, right? Now the next thing would be some HMOs, that Medicare Part B premiums, they refund that back every month. So that's even more money in your pocket. But you have to really figure out, is that the right plan for you? And I will say 25% of the people who we offer Medicare plans to, it does work very well for them. And so that's a good thing, but it's not for everybody. Do understand that. Now, let's HMOs, PPOs, sometimes they even offer over-the-counter drugs. They might give you $10 or $25 a month, where you can get Advil and Tylenol and toothpaste and Band-Aids and that kind of stuff. So that might be a benefit for you when it comes to these HMOs and PPOs too. You get extra benefits, which is kind of nice. So it's really preference. The nice things you get to choose. HMO or PPO, usually no cost. You just pay copays as you go, or you buy the Medicare supplement where you pay a premium. You don't get all those extra things, but you get freedom of choice. You get to go wherever you want as long as you pay that premium. No copays and deductibles if you get the Cadillac of plans, which we will discuss in office, because there's some plans you also have to decide to choose from. So let's talk about now, what if you are already, let's say that's past, Charisse, I picked my plans, and now you want to change up your plan a little bit. And you say, okay, how can I change my plans? Well, every October 15th through December 7th is your opportunity, if you have a Medicare Part C Advantage plan, that's your HMO or PPO, to change to another plan. So you, once a year, get the lease change in case the first shot you tried, it didn't work. Maybe you were with the AARP United Healthcare plan. You're like, you know what, my doctor came off, they went to Blue Cross Blue Shield. Then you go to Blue Cross Blue Shield. So you get that freedom to do so. So I want you to know that. Now, if you're on a Medicare supplement, the one you pay a premium for every month, you can change those plans like you're changing jewelry, ladies. And but they underwrite you every time. So be careful. Let's try to pick the right one the first time. And that's very, very important. One other thing you need to know, when you turn 65, you have this one-time chance, one time to get it right. Because if you're somebody who has diabetes or you've had heart failure and you want to get a Medicare supplement and you pay that premium, they're not going to say, because you have all these health issues, we're going to raise your rate. So that's a nice thing. That's not how they work. But what happens is you have 12 months. Let's say you get on that Medicare Advantage plan, and then 12 months later, like, I really want that Medicare supplement. My health isn't great. I feel like I'm paying more copays than I need to on this Advantage plan. I just rather pay a premium. You have 12 months to change your mind and go back to a supplement without any underwriting. But after 12 months, if you decide to go to a Medicare supplement down the road, they're going to underwrite you. And what that means, you might pay more than your neighbor did who's the same age if you have a lot of ailments. So that's definitely something you don't want to forget when it comes to this. So we talked about Medicare Part A, Medicare Part B, Medicare Part C, and now we're going to talk about Medicare Part D. That is your prescription drugs. So eventually, most people get on a prescription drug, not everybody, but mostly. And so if you get that Medicare supplement where you pay a premium every month, you need to also purchase a prescription drug plan. A prescription drug plan can cost between $15 to $150 a month, depending on what you need. And so really, truly, the best way to get a drug plan, because there's 150 of them out there. I am not going to license with 150. You have no idea the training we go through to offer plans. It's hours and hours and hours and hours and hours every year. I recommend now you just call Medicare 1 month before you turn 65, or 1 month before you're allowed to get one of these plans, and say, here are my drugs. These are my milligrams I'm taking. This is how many days I'm taking. What is the best plan in the city I live in that's going to cost me the least amount? And also, make sure you say this, hit the donut hole the very last. So we have to talk about this thing called the donut hole. So what I mean about this donut hole is that some people get really close. You can go all year round and you get this drug plan. You might pay $15 a month and you pay $10 copay for your drugs. It's a beautiful thing. But November, even though you only paid $10 for this generic drug might cost a total of $150. And if that is the case, they take that total $150 value and they've got a math equation behind the scenes. They add it all up. Once you hit, let me make sure I get my numbers right. I don't want to get it wrong. Uh-oh. It's $4,000 and change. Boy, oh boy, oh boy. It's $4,020 when total drug costs between what you pay and the insurance company pays hits $4,000. Now you pay basically full price for the drug. And so now you're in this thing called a donut hole. And basically they're getting better about that. You're basically paying, let's just see, half price for brand drugs and a little less for the generic drugs, which was a nice thing because before you used to pay full price. And so you want to be careful because half price, if you're paying $10 copay for your generic drug or your brand drug, and it was $150, and now you're in this donut hole, now you have to pay half of $150, that's $75. That's a lot of money, especially if you hit that donut hole really early on in the year. So you want to be careful. We don't hit the donut hole. I have some tricks to the trade to not hit the donut hole. And my client says that's good news. So I actually don't have any clients hitting donut holes because they're following my philosophy. And I actually have a strategy for Medicare, as I do for everything that we do around here for retirement. And then one last piece on this boring prescription drug RX conversation, but you must know this, is that once you have paid a total of $6,350 in total drug costs, now you're out of the donut hole. But here's a little here. That amount that got you in the drug hole, it was the total amount of those drugs. They actually go back and they retroactive back to what you paid in copays, not what the insurance company pays. So you paid $3,650 out of pocket. That's a lot of money, especially if you're taking a lot of drugs. The few drugs you're taking, they could be very expensive. You could be paying a $60 copay and the drug is $1,200. You're going to be in harm's way if you don't plan properly for this. Remember, we talk about planning for income and Social Security and long-term care and taxes. Care is just as important, if I can't express that anymore. Now, once you pay the $6,350 in total cost, now you are in catastrophic coverage. And now you only pay $3.60 for a generic, up to $8.95 for a brand drug, or 5%, whichever is higher. There you go, and then you're covered. And then it starts all over come January the next year, so you got to do it again. So it can cost a lot. So make sure you're reaching out to us if you have any questions about Medicare, because I started doing Medicare 15 years ago. I get it. I know how to do it. I have been through every bump in the road you can imagine. They used to call me the Medicare guru, just so you know. I have a very easy way to explain it on paper, and that definitely helps. Make sure I didn't miss anything here. I already said Medicare doesn't pay for long-term care. And if there's any questions, I will answer them later on because I'm running behind now, and I want to keep my shows to at least 30 minutes. Thank you very much for saving that for later. Okay, now let's talk about debt. Debt runs our lives. And we talk about the snowball effect, Dave Ramsey, how to pay off debt, and Susie Orman has her avalanche strategy. And we're going to talk about which one is better and which one does Charisse like better. So let's just look at this. It says the average American has $4,192 in credit card debt per bankrate.com. This is not including school loans or mortgages or car loans, right? So people live over their means by a very large percentage. And the goal is to try to get out of debt. But hey, there's good debt and there's bad debt. And so if you're trying to get a mortgage, should you get rid of the bad debt first or the good debt? Well, good debt typically are your mortgages, your school loans, any kind of investment moving forward, right? So we want to make payments to those. We do eventually want to pay them down, but it's good debt. It helps us get more credit. So remember that. So let's focus on paying credit cards off first. Dealer's cards, Home Depot cards. You all know what I'm talking about. How many of you got a Home Depot card during COVID? Probably a lot of you, right? Okay, let's talk about these debts. I'm going to start with Dave Ramsey because a lot of people know who he is. Love him to death. By the way, I used to be a SmartVestor Pro ELP with Dave Ramsey. I was already doing what he taught us. I just love knowing that somebody else is doing it the way I like doing it. And I do like the snowball effect. So let me tell you what I mean. And if you've never done Financial Peace University, get your kids on it, and it might be a good time for you to do it. It's fantastic, and you'll learn a lot. But it's only $100 too, by the way. But basically, his strategy is start with the smallest credit card you have. Because you might have a Dillard's card, a Visa card, a gas card, and the gas card has $250, and you just don't pay it off, right? And the Dillard's card might have $1,000, and the Visa might have $5,000 or $10,000. He says, start off with the smaller one because it'll make you feel good, feel like you have pride that you've accomplished it, and then you go to the next one, and then you go to the next one, and then you go to the big one, and then you get excited about paying off debt. You see it, it's a visual. You start to see your credit looking good. So that's a snowball story, which I do like because I think most Americans, that works best. But there's another way that I actually prefer. So the Dave Ramsey story works best because it gives us confidence. But the other one is the avalanche method. We call it the roll down method. It's called paying the debt, those credit cards that have the highest interest first. So if you come to my office, I will always tell you, let's focus on paying off the debt that has the highest interest first, because we're going to save more money this way. And we have more dollars to keep putting back into paying down these credit cards. So I would do that. People have Visa card with a 28% rate, and in a Dillard's card, clearly I go to Dillard's, that has a 15% rate, and a gas card maybe with only 8% rate. I'm going to tell you to pay off the 28% first, because that's the math in my head, that my math works that way, because I can have more bucks later to invest somewhere else, because it's miserable. But I'm going to tell you, it is harder to pay off debt that way, because you're thinking, oh, well, I have this Visa card, I got 10 grand on it, and I only have an extra $250 a month to pay on it. It's discouraging because it takes longer to pay it off. That's kind of the Susie Orman strategy, which, Susie, you're my girl. We need to talk sometime, by the way, if you're watching one of these, because you and I really do see eye to eye on most things when it comes to math. But the Dave Ramsey story, again, I'm going to say it one more time. It's easier to accomplish and makes you feel really good. I've done it myself when I was in college. It really did. But now that I'm older, I have a little bit more saved. Higher ones first. Okay, so it depends on the season of life you're in. If you're watching, you're 40, it might be Dave Ramsey. If you're getting closer to retirement, you're 60 in 5 years, I'm going to say interest first. Let's pay off those high puppies first, and we work down from there. So food for thought. Let me make sure I didn't miss anything here, because I can be very long-winded. And no, we're good there. So that ends our Zinnia U, educating you. We just want to inform you, what's going on, how to tackle things. Remember, we do second opinion reviews. Call us. We'll do a conference call with you guys. I think we even have a place on our website now where you can schedule a 15-minute conference call on ZinniaWealth.com. Feel free to do that as well. And one of our last two segments here is going to be talking about doing good. I have some good stories. And then we have some discounts here locally that we've added that I absolutely just love doing, because I'm all about being frugal and getting the best discount I can on a weekly basis, especially if you're shopping, because I know a lot of people during this COVID are doing lots of shopping. So let's start with doing good news. So did you guys know Shaquille O'Neal visited North and Central Florida recently, and he was on the highway? All right, let's get his video. So let me just explain what's going on here. Basically, Shaquille O'Neal, Magic, Orlando Magic, you guys know who that is, basketball player. He stopped in the Alachua County of I-75 to help a car, and nobody got hurt, which is a great thing. But watch what he did. He stopped in the middle of the road. This famous guy. Watch what happens.
Y'all all right? What's up, man? How you doing? All right. I appreciate you stopping. Appreciate you stopping to help. Hey, everybody good? Yeah. You all right?
Yeah. I didn't slip. I ended up the tire blew and I ended up spinning.
All right, so I got you out, so we're good. Okay. I'm going to leave you in their hands.
I appreciate it. Thank you. Thank you so much. Thank you.
Hey, do you need an EMS to check you out or anything?
All right. So how cool is that? Witnessed a car accident and he stopped. There's some good people out there. Many, many, many. Okay, so I have one more story. Oh, I wanted to cry. It is sad, but amazing. Okay, only because I have a little boy, and basically, we'll put the picture up here. Here we go. It's a 6-year-old boy saved his little sister from a dog attack, according to his family. The boy's aunt posted this photo on Instagram and story, said that the dog charged at him and his sister. The little boy stepped in front of his sister so she could run away, and he was bit several times and received 90 stitches. I just want to cry right now. But he's recovering well, and he's at home. Tons of celebrities, posted this. This was a pretty big social media deal, and congratulations. Just such a little hero out there. Oh my goodness, he looks so sad. But anyways, yeah, we love showcasing, things that are happening that are just remarkable. And to me, these two things were very remarkable. Last part, it will be done here in just a couple of minutes. Travel tip of the week. So next week, I promise I'm going to have a coupon code to go with it for whatever destination that I'm going to have you traveling to. But the reason why we're doing this, because travel has changed. A lot of people are getting in cars and traveling, not getting on planes and trains and ships and that kind of stuff. So we want to help you out when it comes to traveling. So if you ever heard of this little city, not too far, 30 minutes from Gainesville, about an hour from Ocala, called Hawthorne? Well, same thing. Go visit the Marjorie Kinnan Rawlings Historic State Park. This is the historic home of the author, The Yearling. Okay, when I was in 4th grade, I had to read The Yearling, and I was supposed to go there on a field trip, and I got sick, so I never got to go, and I'm going to go. I hear it's really neat. Anybody, I'm sure most of you who are watching has read The Yearling. Great book. Also, they have some great walking and bike trails around Gainesville, Hawthorne State Trails at the same time. And I hear there's a winery over there. I will get better for next week. Wherever the location is, we'll get a food discount or to some sort of admission. We'll make this even better. Now, local discount. So I love this. Teachers and Target. Love this. So right now, from July 19th to August 29th, teachers get 15% discounted on classroom supplies. And how to verify it, you have to just verify that of your teacher status on the Target website. So that's a great thing. Honestly, Target, I want you to give them a bigger discount next time. I think 20-25% would be really kind. Okay, next discount. If you're shopping for furniture, which I will be soon here, let's just talk about Ashley's Home Store is having a grand opening sale with savings up to 50% off items, including sofas, dining sets, and beds. So Ashley's Furniture, they're all over the place. Get that deal, 50%. That's pretty good. And that really ends our discount segment. And thank you guys for tuning in. I want to remind you, I'm here to inspire, educate, get you to retirement and beyond. Go to ZinniaWealth.com. There is a little red book to retirement. It's a download. It's completely free, 37 pages. You need to read it. I don't care how old you are. Talk about wills, trusts, what to do, not to do, investments. It'll help you kind of get things ready. We also have an education guide center where it talks about taxes, Social Security, if you have a 401k, even unemployed, volatility in the markets. We have a guide for everything there. They're free. Download them there as well. Okay, don't forget, catch us here every Thursday at 3:30. Share this with your friends if you want. Tell your friends. If you want to get on a phone alert, we'll send you a voicemail every week just reminding you of this if you really wanted to get annoying. Again, live by design and not by default, and we'll see you here next week.
She is a financial planner and advisor.
He's the founder and president of Zinnia Wealth Management. He's also a popular radio show host.
There's a way to have your money in the market and have protected growth.
This holistic approach will help people get to and through retirement.
Absolutely.
You have to change the way that you think. It's not about having these double-digit returns anymore. Things are changing, and you have to have an advisor that's keeping up with the changes.
Your outcome is going to become very desirable if you have some sort of coach helping you along the way.
And our next recipient from the Media and Communications XP, Charisse.
Charisse Rivers.
Do not have to risk all your money in the market to survive, because it's about the retirement dream.